Good afternoon, everybody. This is Blue Table Talk, and I'm your host, Deborah Jones. As always, I thank you for coming on tonight, joining us. We have a good we have a good talk tonight. So I want you to sit back and relax and pay attention and ask questions. But before we even go into all that, I always do a little housekeeping. Remember, I'm telling you now about the rapid testing for COVID is free. Uh, you can take it at Beaumont Urgent Care, 3650 North Major Drive, here in Beaumont, Texas. The number is 409-333-1272. You also can go to MD Kids Pediatrics, 490 H10 North Frontage Road, suite number 100, 409-212-9988. Also, you get 10 Healthcare, 1495 North 7th Street here in Beaumont, 832-3377, and it's funded. You can go, and also in Orange, Texas at 10 Healthcare, 3737 North 16th Street, 409-920-4223. Also, Boyne Chapel Baptist Church, they have the home test, whereas it's a kit where you can just go and have the results given to you in 24 hours. All you need to do is go to the church, up to the parking lot at the church, and they will give you a slip of paper that has a barcode on it. You can scan it with your smartphone and get the information that is needed. Uh, FedEx will deliver and pick up the kit for you, bring it to you, and pick it up, and that is provided at your home. So you don't take the testing there at the church; they will send you the kit to you, and it is a swab. So FedEx will bring it to you, deliver it to you, and they'll pick it up. Also, no appointment is needed, and everything is free. Okay, everybody, the vaccine is now in. Pfizer has two parts, and you take the first part, and it's 20. You take one, 21 days later, you take the next one. Also, Moderna also has two parts. You take one, and 21 days later, you take the next one, and it has been submitted to the FDA. Johnson has one part, is a one-part vaccine, and they're saying that the vaccine is 95% effective, whereas you take the flu shot and it's 60% effective. But this vaccine they're giving for the COVID testing is 95% effective. The first shipment of the vaccine is expected to be right here in the Southeast Texas next week, December 14th, if the FDA approves the distribution. Also, 3,000 doses would be available the first week, which would be divided up among Jefferson County three major hospital systems. And if you get the vaccine, you still have to wait. You still have to follow the three W's, which is wear the mask, wash your hands, and watch your distance. So even though you took that shot, don't think it's everything is you cool. Everything is you have to do it. You still have to do the three W's. The U.S. surgeon was on this morning, the general surgeon. His name is Jerome Adams. He was on this morning, and he says that they would distribute 20 million vaccine in December, 20 through 25 million vaccines in January, and 20 through 25 million vaccines in February. So if you're planning on taking it, make sure you do what's necessary and do what they ask you to do to keep yourself safe and vigilant. Okay? Okay. Tonight we have on with us, we have Miss Linda G. Clark, and she is a LCSW. She has a private practice right here in Beaumont, Texas. She has been practicing for over 20 plus years. And as we sit here and speak to Miss Clark, let's see how she can help us deal with everything that's going on right now. So, we're talking about coping with the holidays, grief and stress. What I need you guys to do right now, as we speak, is to go ahead and hit your share button so that you can share with everybody, so that everybody can come on and hear, because there might be somebody who's not on right now and they forgot that we're on at 6:30, and go ahead and share it so they can pop in their heads and say, okay, we need to look at this, or we need to ask some questions, and I need you to ask questions tonight. Okay, so first of all, Miss Clark, what is LCSW? What is that?
I'm an LCSW. That means I am a licensed clinical social worker. And that little S on the end means that I am a supervisor A
Oh,
lot of people don't realize that social workers are trained in mental health. I also say that we're the type of social workers that are a glutton for punishment, because not only do we have to obtain a master's degree and sit for the master's exam, we also have to work an extra 2 years in mental health, supervised by other mental health professionals. And at the end of that 2 years, sit again for the clinical license exam. This exam allows us to go into private practice and to function to diagnose and treat mental disorders.
oh, okay. So when we talk about mental health and everything, we talk about like anxiety. We could talk about grief. We could talk about loss and everything. So I want to know, what is grief?
Oh boy, grief is a horrible sadness. Grief is associated with the losses that we feel as a result of death. And we want to encompass also any kind of loss. We have the loss of jobs, the loss of our health, the loss of loved ones, the loss of pets. And right now, due to COVID-19 and this big pandemic across the world, we have the loss of the way we know our world and our lives to be. It's a great sadness associated with loss.
So we when we lose our job, we can grieve through that.
Sure, there is a grief when you lose a job. We need to understand something. Grief is an emotion, and it takes place on the inside of us, which is why you can grieve the loss of anything that's important enough for you to have wanted to hold on to. Mourning is what a lot of times we see on the outside. When we're in mourning, this is when you see people crying, things of that nature. But when you're in grief, it's what is actually going on the inside of you because of that loss. Now, there's this lady out there who's Elizabeth Kubler-Ross. Is who a lot of us as professionals look to. She gave us what we call the 5 stages of dying. Is actually what it is.
Okay.
And we associated that as professionals, we
Uh-huh.
took those 5 stages and we associate them with grief. And it's denial, it's anger, bargaining, depression, and acceptance. And all of those things take place inside of us. And it's not linear. We don't do any of this in a straight line. Let's just say you lose right now, out of respect for what's going on, we have a lot of loss of life, a
Right.
lot. So
Exactly.
as a collective,
Hmm.
we might be in denial. Denial gets a horrible name because people use it so frivolously. But in the mental health profession, when a person is in denial about anything, especially a loss, we're comfortable with that
Hmm.
because the brain needs time, the emotions need time to accept that, to get used to that. And with the pandemic, we are possibly in denial. Some of us has felt it. Oh no, I don't need to wear a mask, do I?
Right.
That's denial.
Right.
Surely I can't get sick from my daughter. They can't mean that I can't see my child. That's denial.
Right.
Because people don't want to believe that something like a virus could kill us.
Right.
Just like that could kill that many of us. Well, that's denial. That's what denial can look like when we don't want to believe that something as simple as a virus could take and run through the world, not just the United States, but the world, and kill us the way it has.
Yeah. Yeah. So does it? A question is that does one? Is there a time limit on grieving? Put it like that.
No, no. The biggest mistake that anybody can ever make is to believe that you're going to get over this. There are some losses that we'll never get over. And one way to put this, I heard another professional say, if you lose a loved one, are they coming back?
Right.
So why do you think your grief
Right.
is going to go away?
Right.
You will grieve this loss as long as that person is not here. Will you grieve as deeply? No.
Mm-hmm.
Will you have better days? Yes.
Yeah.
But as long as that loss has taken place, you will grieve.
Mm-hmm.
And what I work with people is to have them to understand you'll learn to live with this.
Mm-hmm.
You will not get over this. And that's been the mistake that we've made in our lives as a society.
Yes.
We think we're supposed to get over this. And not just our family and friends, we ourselves think it. I've had people come into my office and say, I should be over this by now.
Mm-hmm.
Why?
Mm-hmm.
Because we think I need to get over this. No, 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 no. You learn to live with this.
Mm-hmm.
You learn to live with this person that you love so much not being here. You don't get over it.
Mm-hmm.
And that's just a major mistake that we've made down through time
Mm-hmm.
at telling people they should get over this.
Right.
And they won't.
They
They
won't.
won't.
Right. Well, one person, I'm gonna bring a question up right now from my viewers. She said, "Do you always go through all 5 stages, or should you go through all 5, or should you go through all 5?"
Actually, you go through all 5. You may not recognize them, but you do. You get to you might stay in anger a long time.
Mm-hmm.
I've worked with people who were angry at the loss. And what depending on whatever that loss may have been. I am so mad that my child is not here. I am so angry that my husband is not here. I am so angry that they didn't do what I asked them to do. I'm angry that they didn't wear a seatbelt. I'm angry that they didn't go get their checkup. And you could stay in anger for years. That's why I was saying we can list the 5 stages, but don't think that you're going to just first, I'm in denial. Second, oh, I'm angry. Third, I'm bargaining.
Mm-hmm.
No, you're going to have all of those moments for as long as you manage this loss.
Mm-hmm. Okay, so you know that we in this COVID pandemic era right now, and pray to God that we don't stay here long. How can one cope or conquer loneliness with the holiday cheers when they lose their significant others? So many people have died knowing the cause of it was COVID, and how can we just conquer that?
Okay, clearly the pandemic has left us all feeling lonely, isolated, and fearful. But the thing about it is, I want you to understand something. Last year, I would have been doing a program on grief, and it would have been strictly holiday grief.
Mm-hmm.
This year, I'm doing holiday grief colliding with COVID.
Right. Right.
Yeah.
Yeah.
Holiday grief is colliding with COVID grief. And this is what we're feeling right now in terms of not only do I not have my loved one, but I also can't even be with my loved ones.
Mm-hmm.
Those who would bring me comfort. You mentioned that I'm feeling lonely for my spouse
Mm-hmm.
during the holiday times.
Mm-hmm.
Let's say that that's true. You're missing your husband. You're missing your wife.
Mm-hmm.
And it's Christmas.
Mm-hmm.
My husband loved Christmas.
Mm-hmm.
My wife loved Christmas. She would have this house decorated. My husband would have been all on top of the house putting lights up. All
Right.
of those things that come with that. And now we have COVID. So down through the months, you've learned to get through the holidays because the children are coming over. Or I'm going to see my children. I'm going here. I'm going there to try to feel that loneliness. And now you've run smack dab into COVID that says no gathering,
Yeah.
no family,
Right.
no, don't get together.
Right.
2 weeks
Right.
after Christmas, you'll be sick.
Right.
2 weeks after Christmas, you could be dead. 2
Mhm.
weeks after Christmas, you're on a ventilator. All of those things. So yes, you are struggling to manage. I'm already hurting.
Mm-hmm.
And now you're telling me I can't even get a hug from my son. I
Mm-hmm.
can't get a hug from my grandchildren. I can't go. No one should come over here. So those are things that are very, very real. And these are things that I think it's important for you to realize that you could be angry
Mm-hmm.
mixed in with your sadness. And another thing that you're going to do probably at a time like this is bargain. Remember, I told you one of the stages of grief is bargaining?
Yeah.
Well, what if I just have a few people over?
Mm-hmm. Mm-hmm.
That's bargaining.
Mm-hmm.
Well, what if I sit us all far apart? Yeah, what if we sit outside? Don't care how cold it is. I'm gonna build a fire pit and we're gonna be
Right.
okay.
Right.
Things of that nature. So we're bargaining right now with this pandemic. And that's the truth. That has a lot to do with grief. That's grieving the fact that life as we know it and life as we know how to manage it is not able to happen right now. So we're in the bargaining phases sometimes with this pandemic.
Mm-hmm.
How can I get through this? The thing is this: be patient with yourself, have compassion for yourself, set up a new ritual for your loved one. If you're missing your spouse, make it clear.
Mm-hmm.
Honey, I miss you right now. I wish you were here. I would manage this COVID a whole lot better if
Mm-hmm.
you were home. I miss my husband.
Mm-hmm.
I miss my wife. Say those things out loud.
Mm-hmm.
It's okay.
It's okay. And
It's okay.
I learned that you can talk out loud, and it helps you to talk out loud if you talk out loud. But if you keep it inside, then it's almost like a mind thing.
Yeah, well, if you keep it inside, one of the things that I tell people all the time, when you don't grieve well, you don't do anything well. So it's okay to grieve. We're older. You're going to understand when I say the Kennedys.
Mm-hmm.
You know, when the Kennedys family was going through 2 assassinations,
Right.
and death, they stood before those cameras and they took it. They had the funeral, they walked the streets, you didn't see a tear, you saw nothing. They had that theme of Kennedys don't cry.
Mm-hmm.
That's a major mistake. People do need to cry. You loved someone that you lost, and if you loved them enough to miss them, then you love them enough to have tears for them.
But
It's okay to cry.
Not to cut you off, but you know how they say that the old saying is a man doesn't cry. And so a man always hold it in, but I've seen a lot of men who cried.
Well, the men who sit on my couch have cried. Well, the thing about it is that is a mistake. Society has made many mistakes
Mm-hmm.
that we're learning to try very, very hard to undo. And one of them is to raise our little boys that boys don't cry. We stop our little boys from crying very early on. The thing about it is what I told you before.
Mm-hmm.
Grief is an emotion, and it takes place on the inside. And you need for this to come out.
Mm-hmm.
What you can't fix what you won't acknowledge.
Mm-hmm.
When you don't grieve well, you do nothing well, and grief comes back, and it comes back in different forms.
Mm-hmm.
When you find yourself yelling at someone, you find yourself irritable, you find yourself short-tempered, impatient.
Mm-hmm.
That can be grief. I have worked with many people when they have this problem. They have a drinking problem,
Mm-hmm.
they have an anger problem, they have a frustration problem. And when we start to work together, it won't take more than an hour or two for me to realize you're grieving.
Mm-hmm.
I can't be. My mom died 5 years ago.
Mm-hmm.
And what happened when she died? And that's when you discover everybody told me to be strong.
Mm-hmm.
So I was busy being strong.
Mm-hmm.
Do you miss your mother? Yes, I do. And then they cry. I never thought about that I missed my mother. I never realized that I didn't grieve properly. I just knew that I was told you have to be strong.
I know that a lot of times when we are grieving and then we get with our families, then we get frustrated or annoyed with our families. So how can we deal with our family members when we in that state of mind?
No. I don't think it's the family member that you need to deal with when you're in a state of mind. I think you need to begin to deal with yourself when you're in that state
But,
of mind.
but I mean, okay. I see what you're saying because I'm like snapping at my members, at my family members. You see what I'm saying?
Mm-hmm.
And then you're telling me to deal with me first.
Yeah, you have to deal with yourself. And one of the things that you really need to do is identify what's really going on with me.
Mm-hmm.
And what's going on with me is it's the holidays and I miss my husband.
Mm-hmm.
And you need to say that out loud. And as a result, I'm irritable. It's not meant for your family members to manage you.
Mm-hmm.
It's meant for you to manage yourself and have compassion for yourself and understand what you're going through. And what do I need to do? Maybe I need to keep my conversation short.
Mm-hmm.
Maybe I need to go head on and do my crying if that's what I need to do. Maybe I need to keep my visits a little short. COVID got that taken care of for you. You're not gonna visit nowhere long these days.
No.
But it's really just identifying for yourself what's going on for you.
Right.
Don't make this somebody else's responsibility to manage you.
Right.
Learn to manage yourself by first identifying what's going on and accepting the fact that you need a little compassion, you need some stroking yourself, and you need to give yourself time because I am short patient. I am snapping at you. I am not happy. Remember, I told you about that anger.
Right.
Yeah. It passes through. To the young lady who asked me, do you go through all of the stages? Yes, you do. Some of them longer than others, some of them shorter than others, and some of them in quick spurts.
Mm-hmm. But you do all five of them.
But you do them all.
Yes.
You do them all.
Yes.
Mm-hmm.
Yes. Okay. So hold on, Ms. Clark. Everybody, I need you to share this because this is some good information for everybody because we are going through this COVID and it's a mental thing for us. So go ahead and hit that share button on your computer or laptop or whatever you have, and so that everybody can hear Miss Clark tonight. Miss Clark, also let me ask you one thing. We're going through this mental health thing, and some people are still trying to get their physical health intact. So how do we deal with ourselves and our physical health during the holidays? Because now we got physical, now we got mental. So
well, let's face it. Are you hearing me?
Yes.
Okay. Good mental health goes with good physical health. A lot of times we say, well, I'm depressed. I'm feeling anxious. Why won't I go and jump on the treadmill and go for a walk? I'm stuck inside. If I live in a good enough neighborhood, it's a pretty day. I feel safe. And that's what I mean by good enough. I mean, good enough in terms of I feel safe. I don't think anybody will bother me. I think I'm going to go grab my little stick that we usually walk with for the dogs and take me a walk. Why not? Get yourself out. I think fresh air is extremely helpful. One of the things I did between March and probably August was sit on my front porch more than I'd done in years to get the fresh air. Go for a walk. I know people are not real keen on gyms right now, but there are things that you can do in your home and in your neighborhood and just go outside, get you some fresh air. Try to do whatever stretching exercises you can do. Allow your body to be your best friend and do what you have to do. That goes with good mental health. And that way, if you get up and you begin to do something, that means I'm not sitting here dwelling on my feelings.
Yeah.
I'm not sitting here just simply thinking and crying and not getting out of bed, not putting on any clothes. One of the things that I do with a lot of people, because grief leads to depression, I want you to understand something. You could suffer a loss And you go through, when you ask me, is there such a thing as a time limit? One of the things that gets put on us as a society is our jobs. We have a personnel policy. It gives you 3 days for
Death.
this, you got 5 days for that. It doesn't really work like that.
Yeah.
And so we end up doing the same thing to ourselves.
Right.
But what you have to do is understand that when you suffer a great loss, you are going to be sad. You're going to be. You are just going to be. And part of that sadness comes along with, you might have business to take care of. That business may cause even more sadness.
Yeah.
The business of loss. There's the funeral. There's the planning. And then after that, there may be the business of, hey, I got to call the utility company. I've got to call the job. There's a lot of business involved, and it's very exhausting. We try to tell people you need about 3 good months to just kind of get yourself through, because that it takes about 3 months or so to do some of the business that you still have to get up and do. And then we recommend, look at it in a whole year, maybe even 2 years, because you're going to have that cycle of firsts. You have to have the birthday, your birthday, and the loss of the loved one's birthday. You have to have all of these firsts that you go through. So people need to understand that when you're in grief, you also get foggy brain.
Yeah.
So we ask too that people don't make any major decisions beyond the business of burial and ending some of the personal things that have to be done. Other than that, don't make any major moves. Don't start getting rid of things. Let it sit there. And don't let anybody rush you into getting rid of anything.
Right. I can't speak for anyone else on here, but I can speak for myself. That when my husband passed away, he was on hospice before he passed away. And so before when he did pass, hospice came to me and said that I need to do our not. They said I needed to. They said do I need to the mental health part of it. So of course, me being who I am, a Black woman, a woman of color, okay, and I'm gonna just go ahead and put it on out there. I'm saying no, I don't need it, because I have a power of, I believe in Jesus Christ, but I know He's gonna take care of me, you know. And a year passed, Miss Clark, a year passed, and I wish that I had taken that advice of going to see a psych or somebody, because it's stressful, you know. I mean, to deal with something like that, it's because I was dealing with that. I was dealing, and I'm putting it on out there, I was dealing with his children, and and then it was just hell on wheels for me.
Yes, it is. It is hell on wheels, and you do, after about 3 or 4 months, that is a good time to engage in some type of therapeutic intervention.
Well, because why just Black people don't believe in that? Black people don't believe in that.
Well, it's very cultural that we tend to not understand that it's okay to bring your faith into a therapy session. We think if we get into any type of mental health intervention that we are being unfaithful to God, because that's where all of our source is.
Our source is right there.
And we think that, well, don't forget, God helped the professional mental health professional become a mental health professional.
Right.
You know, Luke was a physician.
Right.
And so while as a therapist, we do not bring in our faith into the room unless you bring it into the room. We're trained in all types of mental health interventions: cognitive behavioral therapy, solution-focused therapy, trauma-focused therapy. But I'm the type of therapist that tells everybody, if they bring their faith into the room, I want you to use it. everybody has a certain amount of ability and coping skill. And if you would have told me I am a believer in God, then I would say, I tell you what, we're going to do some grief therapy, and I want you to bring your God into the room.
Mm-hmm.
I want you to apply your faith into this. I always tell people, if you're on medication, take your medication.
Yeah.
If you have a therapist, see your therapist.
Yeah.
If you have a faith, exercise your faith, because you need all of those things to be employed in order for you to be well.
Right. Right.
Yeah. And it is cultural that African Americans don't necessarily want to go seek a therapist. I will put it like this: the African American clients that I do have, I have them because they sought me out.
Mm-hmm.
They wanted an African American who was going to understand them culturally, understand our culture, understand why we say what we say, why we do what we do.
Mm-hmm.
And that does matter. I think that has a lot to do with one of the reasons why we don't naturally want to do therapy.
Mm-hmm.
We don't trust.
We don't trust. Yes, ma'am.
We don't trust. And we definitely don't want someone who does not look like us to start to tell us what's wrong with us.
Right.
And when we want to talk about mom and them, we want somebody to understand what we mean when we talk about mom and them.
Mom and
And when we start talking about, yeah, when we start saying mom and them, and we want people to understand how come mama hit me in the mouth when I started talking back. Right. And we don't want that. Yeah. So we don't trust. We want another therapist who's going to understand. Oh, yeah, my mama hit me in the mouth once too when I got too smart. And that for us, right. That for us is not abuse.
Right.
We look at that as, hey, that's part of our culture. That happened. It did not mean that mama didn't love me, and it did not mean that mama didn't raise me well. It just meant mama said, you're a child and stay in a child's place. So I got that hand.
Right.
And people struggle to trust. And then also we're taught to believe, it's a myth, that a psychotherapist is just going to play with your mind. And those things are not true either. A good psychotherapist is going to respect the fact that you have a faith, that you do use prayer and meditation, and we want you to employ that. I welcome a person's ability to bring their faith in the room. However, that does not stop me from doing appropriate therapies that this person does need.
Mm-hmm. Mm-hmm. I have some people on here that need to speak to you. Don't forget, everybody who just came on, don't forget to share. Don't forget to hit that share button. Thank you, Anna, for sharing for me. Here's Mahogany says, this has been me for the past few months. It's hard when I have no time for me to take care of me now. I look like Mahogany has children, so I guess she's taking care of children and possibly her husband, and no time for her. So she's going through.
Yeah. Well, I would have to tell you, Miss Lady, you have to put yourself on the burner.
Mm-hmm.
One of the things, let me put it like this. I'm a person too. So I understand exactly what you're talking about. And when I say I'm a person as well, I understand what it's like. I've been married 43 years and I've raised 3 sons. That's what I mean when I say I'm a person as well. So when I give you these things to think about, don't think that it's in complete isolation and not understanding. I do. I'm a wife and a mother and a grandmother. So I understand what it's like. And I went to school between the ages of 19 and 20 for my undergraduate work, but I did 2 master's degrees after having raised children and still having one left at home. So I understand the hustle and bustle of it all. But you also have to understand that you have to put yourself on the burner.
Right.
There comes a time when every mother, every wife puts children to bed.
Mm-hmm.
There comes a time when every mother should incorporate, this is our quiet time. Mm-hmm. Teach your children how to read a book, even if they can't read. Let them know this is your quiet time and let them thumb through their own book, because mama is having her quiet time right now. you have to make sure that you are on the burner, even if it's for 10 or 15 minutes.
Mm-hmm.
You matter and you count. And the only way that that's going to come through is if you demand it. I need my time. And it's okay to want that. And it's okay to ask for that. And it's
Mm-hmm.
okay to carve out time for that. It may be late.
Right.
I don't know how you run your house, but it may be late in the evening. And it may be at 10:30. But 10:30 matters. If
Mm-hmm.
you got from 10 to 10:30 or from 10:30 to 11 o'clock, and this is for you, this is my time, then it's mine.
Right. Right. One of the questions that I was going to ask you later on was going to be dealing with anxiety, but it looked like this lady started asking us beforehand, and my thing was does grief and anxiety, what does grief and anxiety do to your body? But she wants to know, can anxiety cause acid reflux? So she's on the
Yes,
right.
ma'am. Yes, ma'am, it can. When a person has anxiety, one of the first things they'll tell me is I get flutters in my stomach. My stomach will hurt, or I feel like I'm going to throw up. You have a lot of physical symptoms when you have anxiety. A lot of people don't realize, they just think, okay, I'm depressed, that's just sad. But anxiety tends to present more physical, shaky hands, heart palpitation, nervous stomach, acid reflux. So yes, ma'am, when you have anxiety, you can have acid reflux. And when I said it earlier to the young lady who said, how do I find time for myself? This is a person who has anxiety really does need to learn different types of skills and exercises in order to be able to calm themselves down. Because eventually acid reflux is going to wear out your stomach and your esophagus. So
Right.
you're going to want to learn, how do I control myself and how do I bring myself down so that when I'm later in life, when I'm in my 30s or 40s or 50s, I've not worn out my stomach. I don't have an ulcer, things of that nature. Anxiety presents physical feelings and ailments.
This one of the ladies says, Cheryl Chambers, she says, yes, I went through group grief counseling after my daddy passed away. It really helped me to deal with my emotions. Am over it now, and am better. Am I over it? No. Am I better? Yes.
Thank you for validating that, because that's exactly what I mean when I say it comes in waves. You will get better, but that doesn't mean that you won't have moments when you miss your dad tremendously or any loved one tremendously that you have lost. And you'll wake up one morning and say, my dad just died this morning. But in fact, it was 12 years ago. It was 5 years ago. It was a year ago, whatever. But there are moments when it can feel like it just happened this morning. That can happen. So good for you that you're better. What happens over time is it doesn't hurt as bad, but it doesn't mean that it will go away.
Right. Right. Exactly. I mean, there are times when I still cry. My mom passed away in 93, and my dad passed away in 98. And there are moments when I still cry, because you miss them.
Yeah, you miss them tremendously. This brings up a point I want to make as well. I want people to understand that the anniversary of their death can also hurt. You may not even understand why you're suddenly sad. What's wrong? And then you'll realize, oh, this is the month my mom died.
Mm-hmm.
This is the month my dad died.
Mm-hmm.
So when you feel a sudden sadness comes over you, or you feel irritability taking over and you can't really pinpoint what that could possibly be, I want you to stop and take a look at the calendar. Stop and think, oh, because you could be doing really, really well. This is not on your mind, but suddenly a sadness will take over and you'll realize, oh, it's that time. Now, does that happen to everyone? No. There are people who, after a while, they're not sentimental in that way, nor do they have those kinds of feelings that creep up on them. But you might discover that you're the kind of person where this loss was so impactful that there are feelings around the anniversary of their death that might creep up on you.
Anna Johnson wants to know this. This is a good one. How can we help our children who are very smart to cope with the current pandemic? How can we help them?
It really should be age appropriate.
Mm-hmm.
I think one of the first things you want to do is make sure that you're not listening to a whole lot of television news and television talk, that try to curb the information that's coming to them. Also try to curb some of the information that's coming in at you, because it can be very, very scary. One of the things that you can do is sit down and talk with your children about what they think they know, and try to put it in terms that they understand. If it's a cold, if that's a better word for you to use, well, why are people wearing masks? Why do I have to wear a mask? And you want to explain everything in the simplest terms to them so that they can understand. And I'm struggling a little bit to answer the question because I don't know how old the little ones are. I have a granddaughter who's 5. And she said, you know, Grammy, I wear my mask because there's a virus out there. I said, oh, yeah, you think so? And I said, well, what does the virus look like? She told me, I know what the virus looks like. I said, well, what does it look like? Well, she had seen on television the scientific red ball with all of the little red dots around it. She saw that on television, and this in her mind is what she concluded. I am trying to protect myself from the little red ball that's on television. So she wears her mask. And her mother taught her the same thing. We just want to be safe, and we don't want to spread germs. And we don't want to give other people our germs.
Right.
Okay, she said her son is 9.
Right.
This is when a 9-year-old is someone that you want to tell as much information to as possible in terms of it being something that can make us sick, and that it's a germ that we don't want to spread from person to person. It's invisible. We can't see it. But if we get it, we'll start to feel it.
Right, right.
And a 9-year-old can understand that. A 9-year-old can also understand that people get very, very sick, and they can catch it from someone else. And we want to prevent that. So we wear our masks, we wash our hands, and you want to help him to develop rituals of hand washing, mask wearing, and help him to understand the ritual of keeping himself safe and keeping others safe. And this is what we want to do. I heard you in your opening talk about a vaccine is on the way. One of the things I really wanted to chime in and say, they want, the Center for Disease Control and all of the scientists want about 70 to 80% of the population to be vaccinated.
Right.
Before we start looking at, we're going to take this mask off. And one of the things you tell a 9-year-old, any child, is that it's not going to always be this way. That's what you do. You give them the hope of understanding and believing it's not going to always be this way. We're going to be able to take off our mask as soon as all of us get our shots. And a 9-year-old has already started getting shots. So he's going to understand that too, that when everybody starts getting their shot, then we can take our masks off and we should be okay.
Okay, so by her son being 9 years old, and then we're dealing with this COVID situation, and I know he's watching television, whatever, and he sees so many people who have already passed away or died or whatever, how you ever want to say it. Should they explain that to their child? Do they really and truly understand death?
Children at 9 years old, they definitely understand death, and they can, in this modern world of technology with computers all over the place, they may indeed hear that so many people are dying. And the way COVID has done, this child could have experienced a direct loss, He could have experienced that his friend's mother, grandmother, grandfather, he knows someone, because we all know someone who has passed away from COVID. We all know someone whose family member has been affected if we haven't been directly affected ourselves. This little boy can be told that yes, this virus makes people very, very sick and they can pass away. And we're not going to be afraid that we're going to pass away, because we're going to do everything we should do. We're going to wear our masks. We're going to wash our hands. And we're going to do what we call social distance. We're not going to stand too close to people, and we're not going to let people stand too close to us.
Exactly. Let me see. Dolores Clark says, "Are you planning on getting the shot?" Now, I don't know about Miss Clark, but I am, because I'm a diabetic. I take the flu shot. So, and the flu shot is supposed to say 65% effective, and they said this shot is 95% effective. I know I am. I'm not taking. Well, a 90-year-old lady took the other day, today. So since she took it in the UK, I'm gonna wait a while anyway. So it's gonna be a while before it get to us. So I'm gonna take it though. What about Miss Clark?
Okay, if that question is meant for me to answer the question, the answer to the question is yes. I do intend to take the coronavirus shot. And I understand why you're asking this question. Once again, we're talking cultural. And we're not talking cultural without substance. We do have proven studies that have shown us that African Americans have been used as guinea pigs for a lot of things.
A lot of
So
things.
for a lot of things, and I understand that. However, this is not going to be part of that study. We are we're not being used as guinea pigs. People across the world are getting sick, and people across the world are dying. And yes, you can take the shot. Let's just say if the coronavirus shot comes out January 1st, it's okay to wait until March.
Mm-hmm.
If something is going to happen or someone is not going to do well from it, you'll know by March. If the shot comes out, I think it's a series, you have to take two shots. They 21 days apart, it's my understanding. So let's say you take the shot January 2nd, and then you take your next shot, what, January 22nd,
Yeah.
21 days or so later, and you're fine. And then, yeah, so that group of people will have had 3 whole months of the shot in them. So if you want to wait till March or April to take it, you go right ahead. And that might be the group that I fall in. But I do intend to take the coronavirus shot, because I want to be a participant in making sure that by July or August, 80% of the population has been vaccinated. And now I can start to travel and go places and do things that I've done normally in the past. I want to be part of that population and be able to say that I did my part and I took care of myself and others along the way.
Right, right. So because let me tell you, I like I said, I took the flu shot. I took it in October, and when shingles came out a couple of years back, I was saying the shingle shot. I said I'm not taking that shingle shot. They cannot make me take that shingle shot. And guess what? I got the shingles. I couldn't wait to get over the shingles. I ran out there, and got the shot, but came in 2 segments though, and so I took one, and a couple of months later I took the other. But you can't tell me not to take any shots there is, because I will be taking shots. So
okay, but to people out there, I don't want us to lose our subject matter. That we're talking about grief and grieving. We're talking about the pandemic colliding with our holiday grief and with our natural grief of the losses that this country has suffered and that we may have suffered personally. One of the things, remember what I said early on, that grief can cause foggy brain.
Foggy brains, right.
And as a country, the United States is suffering too from foggy brain. We're suffering from this in a collective kind of a way, because we're suffering from the coronavirus in a collective way. We're suffering great losses in a collective way. So when you start to find yourself being skeptical of everything, this is when we talked earlier about how do you take care of your physical and your mental health. This
Mhm.
is when you say, let me step back, let me take a break. I need a news break. I need a break from all of the pain and loss, and I need to get some rest. And then I need to go back and take a look at what's important.
Mhm.
Where is factual, actual, scientific information? You don't want to make a decision about this shot. You don't want to make a decision about relaxing any of your behaviors without being well informed. When you have big decisions to make, you don't want to make them with foggy brain.
Right.
You want to make them when you're calm, when you've been thoughtful. Don't make it because I hear all of this on the news. I heard my girlfriend say this. I heard this on TV. I saw this on Facebook. You want to stop and pump your brakes and start thinking about what's going on in your own self house, what's going on in your own world,
Mhm.
not in the world of people you don't know. It's just like, Miss Deborah Jones was saying, hold up. I had to stop and think about myself.
Mhm.
I thought about my health. I thought about my pre existing conditions. I thought about what I didn't want to go through again. And I allowed that to inform me. So I want you to understand we are grieving the loss of the life we know.
Right.
We are grieving not being able to go to the mall when we feel like it.
Right.
We are grieving that we can't have 50 people over. We are grieving that I can't go to a party that I usually go to. We are grieving that oh my God, my loved one died. Oh my God, my friend's loved one died. Oh my goodness, the lady I used to talk to passed away. We are grieving. We are suffering.
Mhm.
So when you start talking about what I should do, what I shouldn't do, this is when you need to get quiet. And this is when you need to start to apply what's really going on with me.
Mhm.
That's going to help me make a calm, informed, and best of my knowledge and best from myself and my family decision. That's the way those decisions are made.
Right. Right. Whew. You gave us a lot tonight. And I thank you for. So let me ask you a question. Do you consider yourself as a life coach or a counselor? So, and if so, what's the difference between the two?
Well, I'm a licensed clinical social worker, which means I am a clinician trained in mental health. I diagnose and I treat mental disorders. I use and work with psychiatrists who actually give the medications. I don't prescribe medications, but I work hand in hand with doctors who do.
Mhm.
And I know about medications and what they're supposed to do for you. Um, I'm a psychotherapist. I'm licensed. I cannot treat or work with a person except I have my license. I deal in mental health. I am not a life coach. Now, in terms of psychotherapy, it's hard, courageous work. When people come to me, they come to me for years. They don't come for a quick fix. We delve into just, into your life and how to change it. Just some days it feels like life coaching. It may. But on most days, it is really and truly dealing with your mental health issues. I work with people who have major depressive disorder. I work with people who have generalized anxiety disorder, people who are schizophrenic, people who are bipolar. I am not a life coach. I'm not Ilanya, is probably what people want to think about. I'm not Ilanya. No.
Or Dr.
We
Phil.
don't, yeah, well, Dr. Phil is a psychologist.
Right. He's a psychiatrist. Right.
He's a psychologist who gave up his license to go on television. If you pay close attention to Dr. Phil, his work is good. Elanya's work is good, but you need to understand that they have a lot of research and work that they've done before they put their 45-minute show on air. The
Mhm.
problems that I work with people, they're not solved in 45 minutes. Yeah.
So what would make us come to you? What I mean, I need to see somebody. I need to see somebody about my grieving. I need to see somebody about my anxiety. Is that what makes us want to search you out?
Actually, actually, when a person comes to my office and sits on my couch for the first time, that's the first question I ask. So, what made you pick up the phone and call me? And usually, we have what's called the presenting problem. Somebody might say, "Well, I'm angry all the time. My husband said he can't stand me no more. My friends say they can't stand me no more." And I realized that I need some help. So I thought I would come and sit down and talk to somebody about what's going on. And then we tend to go from there. I also get people who are referred to me by their psychiatrist. We don't believe that a person should be on any type of psychotropic medication without possibly having a therapist on board to help them with their progress along the way. You can't think that medication is going to do all tricks for you. There's some things that you need to do too along with your medication.
So
So what?
you with children also?
No,
Okay.
but I don't. As a rule, I did work with children, like the lady who talked to me about her 9-year-old. I did work with children in the past, but one of the things that a good therapist does is make sure that they're well trained in their skill. And I haven't worked with children in quite some time, but I do have a therapist that I do refer children to. I work with general adults. I have a few children, teenagers that I will work with. But most of all, I think it's important that for little ones, adolescents, they need to work with someone who specializes and is constantly being trained in adolescent health problems. I work with the general adult who may have problems. So a person comes to me because they may be grieving.
Mhm.
That would be true. A person may come to me because they have been feeling depressed and sad for a very long time and they're tired of it. I have people that come to see me because they're having problems in their marriage. I do couples therapy. And a lot of times, if I can't work with the couple because one won't come, then I work with the individual. Because remember what I told you earlier, if you work on you,
Mhm.
then the rest of it will begin to take care of itself.
Yeah.
So even when a person may call me and say, I'm having marital problems, but my husband won't come. I'm having marital problems, but my wife won't come. I said, well, you come. And maybe if we can get you together and you can see some of the changes that you can make or some of the things that you may be doing, then maybe the marriage will get better. Or maybe your spouse will want to participate. So we go from there.
Okay. I have two questions. I know it's almost time for us to get off, but I have two questions. I need you just to look at them. So how do you cope with dealing with so many people with problems? People, how do you deal with them? If they have a problem, how do you deal with those problem people?
It sounds more like you're asking me why am I a psychotherapist?
So I think so. All
I'm
right.
a actually I'm trained.
Mm-hmm.
That's what it takes. You remember I told you the first thing is the educational training and then the mental health training, the licensure, and working in this field for a very long time that I learned to do my job, help the people that need help. You get trained to understand that it's not about you. It has nothing to do with me. It's me wanting to help people. And I am a social worker. And a lot of people, like I told you, never think about social workers going into mental health. But one of the things you get trained to understand is why you're doing what you're doing and how to do what you want to do. I'm gonna give you a little story. When I was in graduate school and I had to do my internship in the hospital, I was real proud of myself when I went back to class because I had to work with a lady who had been told that her sister was going to pass away.
Mm-hmm.
And this lady had not seen her sister in years, and yet she was the next of kin, and she had decisions that had to be made. And this lady cried really hard. It was heartbreaking kind of crying that she was doing. And my immediate response was to go to her and hug her. And I did. And when I went back to class to share what had gone on in my field placement and how I handled it, my instructor looked at me and said, "And tell me again why you hugged her." And what he helped me to understand is that I hugged her because I needed it.
You need it too.
I didn't hug her because she needed it.
Mm-hmm.
And when you ask me, how do I learn how to manage other people's problems? It's because I've been trained to understand that it's their problems.
Mm-hmm.
It's not mine.
Not yours.
So part of being well trained and part of being a good therapist is understanding yourself, understanding what your needs are. And if you need therapy yourself, get it yourself.
Mm-hmm.
Our therapy usually comes from our supervisor. Our supervisors are therapists, and they help us to identify where our areas are and what kinds of things that we need. And in that early in my training in the classroom, I learned that I came from a family and a culture where reaching out to a person is important, hugging a person is important. And I was, as a therapist, you get trained to know how to let a person know that you care,
Mm-hmm.
how to let a person know that you feel their hurt and their pain without invading their space. Because you understand that people come from all walks of life, they come from all kind of cultures, and touch for me may not mean the same to someone else.
Okay. This last question says, I definitely need to speak with someone. My issues are deep. Okay, Mahogany, her information is scrolling across the screen, address and her phone number and the website. So are you taking new patients?
I am, but I need for people to know right now it's holiday time, and I'm on the slowdown. But I have a couple of more days, in the month of December that I will be working, and I do take patients. I take insurance. I take Blue Cross, Aetna, United, Cash, all of it. Yeah, I am taking new patients, but it just depends on the room that I have. I think people think when they meet me and they see me and they start talking to me, they think that I'm going to say, okay, you can see me tomorrow. No, don't forget, I am in business. I am in a private practice, and I do have a client population that I see on a regular basis. But I am accepting new patients, and I will find a place for you if it's possible before the holidays truly set in. I hope.
When do you stop? I'm sorry. Go ahead.
I hope that I have delivered what you had hoped for, Miss Jones.
Yes, ma'am. Yes, ma'am.
I really do,
yes,
because I think grief is important, and for people to understand that we are having a collective grief along with our personal grief. It's all colliding right now, and it's important that they understand what's happening to them and why they may not be managing themselves as well as they normally would.
And I'm noticing from my listening audience that you have helped them also, because they wouldn't ask the questions that they did if you didn't help them, if they didn't see the help that they needed. So I know I appreciate you, and I know and everybody said on here good information, and we appreciate you and everything, and thank you for the information. So I thank you, Ms. Clark, for giving us the information that we needed on grief, coping with grief, and I hope that it could help us during these holidays, because we still have Christmas to go, so, and we know that we still can't go and be with our family during Christmas holidays. But let's do what CDC says and get it together. Wear your mask. What is it? Wash your hands and watch your distance. And we already know that there are a lot of people out there right now not wearing masks. So, Miss Clark,
They're in denial.
in denial. Yes, right.
They're in
And
denial.
I don't know what's gonna shake them up. But when they get close to me, I have to tell them to back up. So we appreciate you, and I appreciate my listening audience tonight. As usual, I like to bring someone on here to give you some good information. And this is just part one. We have a part two coming up in January. So maybe Miss Jones, Miss Clark, I'm calling you myself. Maybe Miss Clark could come on one day and say, let me come on talk to the people. You got it. If you need to, I'm here for you.
I'd love to be invited back and just chat.
Okay, let's do that. Let's make that a date. Okay. So thank you guys. We appreciate you. God bless you. You know, as I always say, if I can help somebody as I pass along this way, then I know that my living is not in vain. God bless you. God keep you is my prayer. Smooches. Stay on, Linda.
Thank you.